Morning, ako si Marlon Longos Castro, medical student ng Our Lady of Fatima University. Ang gagawin natin ngayon ay i-physical exam natin ang extremities mo at ang spine. Ano mo na ang buong pangalan?
Marlon Longos Castro po.
Okay, let's start with your hand, wrist, and fingers. Let's observe the color. The skin is brown in color. Then there is no nodules, no lesions, no scars, and no deformities. Okay. May masakit?
Wala po.
No tenderness and crepitus. For the palmar aspect, there is no hypo and hyperpigmentation, no lesion, no nodules, no scars. May masakit?
Wala po.
And no tenderness. For the range of motion of hand, wrist, and fingers, ganito muna. Flexion, yayain mo ako. Extension, abduction, apposition, okay. Radial deviation, ulnar deviation, okay. Pakigrip yung fingers mo. For the strength, pigilan mo, pigil, pababa. Okay. The patient has an intact range of motion in the hand, wrist, and fingers. Okay. Next is the forearm. For the forearm, okay, the skin is brown in color, no hypo and hyperpigmentation, no scars, no tattoo, and no nodules and masses. May masakit ba?
Wala po.
No tenderness and crepitus. For the range of motion of the forearm, ganito, gayahin mo lang ako. Pronation and supination. Pronation, supination. And next is the elbow. For the elbow, let's observe for the olecranon bursa. The olecranon bursa is not swell, not warm. May masakit ba?
Wala po.
No tenderness. Okay, no nodules and no masses. For the range of motion, we have the flexion, extension, supination, okay, pronation, supination, pronation, supination. Intact. Then next is the upper and lower arm. For the upper and lower arm, brown in color, no lesion, no scars, no hypo and hyperpigmentation. Okay, then let's measure the symmetry of the upper and lower arm. Two inches below, 7 inches. 7 inches in the lower arm, upper arm, 7 inches also, symmetrical. Have the left side, 2 inches below, 7 inches below, and 7 inches also. Okay, the arm is symmetrical. Next is the shoulder. We have to examine the shoulder joint. Clavicle. May masakit ba?
Wala po.
Okay. No redness, no swelling, no tenderness. Okay. Normal. Then for the range of motion in the shoulder, tayo ka, gayahin mo ako. Okay, flex, ito, flex, extend, hyperextension, then abduction, adduction, tapos internal rotation, tapos external, internal, ito, sabay, internal, external, internal, external, okay. Then, buka na. Next is we're gonna check for your spine. Okay. Let's observe or check for the spinous process of the vertebra. May masakit ba?
Wala po.
Let's check for the paravertebral muscle. May masakit?
Wala po.
And let's check for the alignment of the vertebra. Okay, the vertebra, for the cervical vertebra is concave. Then the thoracic vertebra, convex. And lastly, the lumbar vertebra, it is concave. Concave, convex, and concave. Motion of the cervical vertebra. Ganito, gayahin mo lang ako. We have the flexion of the neck. A lateral flexion, right and left. Then, lateral rotation, right and left. Ikot. Right, left. Okay. Okay, we have an intact cervical vertebra. For the thoracic and lumbar range of motion, gayahin mo lang ako. Flexion, pakabend mo. Extension. Okay, right and left, bending. Right, left. Yan, dito mo. Okay, then right and left rotation. Okay, intact. Next is we're gonna check for your lower extremities. Una muna yung hip mo. Test natin. Meron tayong tinatawag na Patrick sign. Patrick test. Sabi mo kapag may masakit sa hip. Sakit?
Wala po.
Sa kabilang side. Masakit ba?
Wala po.
Okay. Next naman is the anvil test. Sabihin mo sa akin kapag masakit yung hip ba? Sakit?
Hindi po.
May pain?
Wala po.
Okay, negative for anvil test. And next test is the straight leg raise test. Okay. May masakit ba?
Wala
sa hip?
po.
May masakit?
Wala
sa
po.
hip? Okay, negative. Next is the thigh and knee. Thigh and knee, range of motion, flexion of the thigh and knee. Okay. Flexion. Then, internal rotation of thigh and knee. Internal, external. Internal, internal, external. Okay. Next is the foot. We have to observe the foot. The foot is brown in color. No lesion, no mass. No signs of fungal infection. The toenails are pinkish. May masakit ba?
Wala po.
Okay. No tenderness. Okay. For the range of motion of the foot, we have plantar flexion, dorsiflexion, inversion, eversion. Ulit. Plantar flexion, pababa, pataas. Inversion, side, eversion. Okay? Intact. Okay na. Thank you.